most famous physical therapist on the internet.
Hi folks, I'm Bob Show, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
We're
Bob.
dressed casually today, aren't we, Brad? Well, I
Yes.
guess you're always dressed casually. Today
Wow,
we're going to talk
absolutely.
about 3 simple leg exercises for seniors in bed. Actually, it could be for anybody.
Sure.
But to help you decrease knee pain. There's a lot of knee pain among seniors,
Right.
unfortunately.
Yep. You got to
lot
get
of
it moving
arthritis.
and strengthen the right muscles.
So yeah, each of these 3 exercises is designated for a certain task of the knee. So we'll go over that when we're talking about each exercise.
But
If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Go to bobandbrad.com. We're doing a giveaway. We're always doing a giveaway, Brad.
that's right, Bob.
And this week we're giving away some workout bands, right?
Yeah,
Bob and
workout
Brad
bands.
workout.
Yep, they got really nice handles. Our names are on them, and you can depend on good quality.
And we're also throwing in we want to pan over there. We're throwing in some wall anchors.
Right, so you can attach them very simply to the wall and work with them. You just go ahead, Bob.
All right.
I'm going to get my workout.
You can
in.
also find the contest pinned to the top of the page at Facebook. And if you go to Twitter, Instagram, or TikTok, you can get a 60-second version of our program every day.
Say no more, Bob.
I'll say something more because I got to talk now.
Oh, that's right.
So the first exercise is for quad strengthening. This is the most affected muscle with surgery, arthritis, almost any knee problem. That's the muscle that tends to deteriorate the fastest.
Right. Shrinks away after one of those surgeries, or you have knee pain. The body tells it to turn off because it creates pain. So we got to work around that.
Yeah, so we got to fire that one back up. Brad's going to show this. These are easy to do. You don't need any weight. Brad's going to wake up.
Yeah. Well, I like doing these because I get to lie down.
Yeah, wow. It's right.
While we demonstrate. So
Going to fold the pillow in half.
Yeah, these are, I got my jammies on yet. So yeah, this is for my head, obviously, but you're going to need a pillow, or you could use a towel roll or something about this size. You could even use one of those, couldn't you? But that would be awkward.
Oh, yeah.
So something under the knee.
And what you're going to do is you're going to actually, it's somewhat isometric, isn't it, Brad?
Yeah.
Because he's going to press the knee down into the pillow and hold it for a count of 10. And you're going to do 3 seconds, 3 sets of those. So I'm sorry, it's a 5-second hold. We're doing 5-second holds on all
Yep.
these.
And how many repetitions?
3 sets of 10.
Oh, so a total of 30.
Total of 30.
Right.
Now, if you want to do one of the set of this and then go on and do one of the other exercises,
right,
you can do that if you get bored. But
right.
I think a lot of times it's better if you do all 3 sets in a row.
Sure. You know, and if there is some pain with it or something by the time you get to the first set, you may only want to do 1 set of 10 the first day and build up, depending on how your knee tolerates it.
Most people should be able to tolerate this, though, because it's isometric and it's pretty easy to do.
Yeah.
It's a pretty basic one.
So I can really feel those quads working, Bob. I'm squishing that pillow down. It's harder than it looks, actually.
Yeah. Hopefully. So Brad's going to now go to bridging.
All right.
And with the bridging, we're going to get, again, some quads, but we're also going to get the glutes. And these both help strengthen the knees. And plus, we get the hamstrings a little bit, too.
You bet.
Go across. So same thing. You're going to lift up, hold for 5.
Yeah. And you may want to put your hands down here. It's a little easier when you start.
He goes up to level. You see he's got a nice straight line going there.
I'm really pinching those butt cheeks together.
That's the muscle that you're trying to focus on. It really helps if you do think about it, because they've done studies on that, Brad, where they have found that if you focus on the muscle, it actually strengthens quicker.
Right.
So that was more than 5 seconds, Brad.
I know. I was getting cramps. Just kidding. I was fatigued, though, that's for sure. So, again, squeeze those butt muscles together. I'm pushing down. If you want to go like this, it's a little more difficult as opposed to down here. That's up to you.
So keep it simple. We're doing 3 sets of 10 for each exercise. 5-second hold on this one, 5-second hold on the quads. The last one, you don't have to have a hold because there's... All right, Brad.
I'm counting my 5 seconds.
Yeah, very good.
Otherwise, I get carried away. Whatever.
You didn't have to stomp. 1, 2, 3. All right. Why don't you lie on your side now?
Okay. I'll face the camera.
Sure.
Yep.
Now, for a lot of people, over time, their knees start to kind of come in a little bit. And you want to strengthen the muscles that turn it out, bring the thigh out. This is especially important for people who you may even do it and you not even realize it.
Sure.
Like bring your knees in a little bit when you're walking or getting up out of a chair. So he's going to do clamshells here. So
I'm going to take this leg. Put your feet together so they're touching, and then they maintain contact if you can, and just bring this knee up as far as you feel comfortable and back down. But don't let it just drop down. Good.
Yeah, you're working
control, both directions, and do 10 of those.
So it looks like a clam talking to you, doesn't it, Brad?
Yep, exactly. And I can feel that muscle. We got a real specific muscle in that hip that's working there.
Again, doesn't look like much, does it, Brad?
No, it doesn't. But when you go slow like this, it clearly
and
is.
You do 3 sets of 10 and you're just starting off, you'll feel it.
And you do have to do the left side.
Yeah.
Turn over and
over
do the right side. But
right.
I'm not going to turn over and show you my backside. That would be embarrassing.
There you go.
Yep. Is that it?
Yeah, that's it, Brad.
Okay.
This is supposed to be simple. These are simple.
And you get through that, and you'll get to the point where you're used to doing it. That won't take more than a few minutes.
Right, and then eventually you can progress on to maybe more advanced ones, which we have in other videos.
Right,
So,
for seniors.
all right.
All right.
Take care.